Hello, my name is Joanne Bargman, and I come from Toronto, Canada, where I am the director of the peritoneal dialysis program at the University Health Network. Today we're going to talk about mechanical complications of peritoneal dialysis. The objectives of this talk is to learn about the increase in intra-abdominal pressure that comes from peritoneal dialysis and ways that you can reduce that pressure. Also, with this talk, you should be aware of leaks of dialysis fluid and hernias as a consequence of the increased intra-abdominal pressure. And finally, to learn about how to treat the consequences of hernias and leaks of dialysis fluid. Installation of dialysis fluid into the peritoneal cavity leads to increased intra-abdominal pressure. Just how much that pressure goes up depends on the volume of the dialysis fluid instilled, the position of the patient, and I'll show you that it depends on whether the patient is supine, standing, or sitting. Older age and increasing body mass index also increases intra-abdominal pressure, and then the patients may do other activities such as exercise, and these can transiently increase the intra-abdominal pressure. This is a schema that was put together by Professor Twardowski many years ago. On the x-axis is the volume of dialysis fluid, and on the y-axis is the intra-abdominal pressure. You can see that the more volume of fluid that is instilled, the higher the intra-abdominal pressure. But this is highest when the patient is in the sitting position and lowest in the supine position. So, for example, for a 2-liter volume of fluid, the lowest intra-abdominal pressure would be with the patient in the supine position compared with other positions. Let's take a true example of one of my patients, a man with IgA nephropathy who received a kidney transplant successfully for 10 years but started losing function due to chronic allograft nephropathy. He returned to peritoneal dialysis, had a catheter put in uneventfully, and was trained on cycler dialysis. He was discharged on night cycler dialysis, dry during the day, and did fine. 1 month later, a day dwell was added to his dialysis regimen, and soon after the day dwell was added, he came to the dialysis unit complaining of an edematous penis, and you can see the photograph of that here. What would you do if a patient came to your unit with this scenario? Would you prescribe high-dose diuretics to try to get rid of the fluid? Ask for a urology opinion? Get a CT scan with intraperitoneal contrast, or get a test for venereal-associated diseases such as syphilis. The best answer here is to get a CT scan with intraperitoneal dye mixed with peritoneal dialysis fluid. On your left is a Scout CT scan, and what you can see here is some edema over the penis. On the right is a CT scan with PD fluid mixed with radiocontrast dye, which appears white in the peritoneal cavity. And what the arrow is showing is leak of this dialysis fluid through a defect in the peritoneal cavity and going into the soft tissues of the torso. The source of that leak was one of the portholes that was made during the laparoscopic insertion of the peritoneal dialysis catheter. It didn't heal completely, perhaps because this patient had been on corticosteroids for many years for his kidney transplant. When he was dry during the day, there was really no increase in intra-abdominal pressure and really nothing to leak through this unhealed porthole. But when the day dwell was added, you therefore had fluid in the patient during the day when he was subjected to higher intra-abdominal pressure, and you had leak of the dialysis fluid through this porthole into the soft tissues, and from there the fluid migrated over the penis, and that's why he presented with the swollen penis. Leaks can also be detected not just by CT scan with IP dialysis and dye mixed together, but also with PD fluid mixed with radionuclide. And these are some examples, and this scan here shows a leak of fluid through a patent processus vaginalis into the scrotum. And in this case, you can see a leak of fluid across the diaphragm into the pleural cavity, something called hydrothorax, which we will come to in a minute. So the patients who present with these kinds of leaks usually present with swelling of the abdomen or bogginess, and I'll show you some pictures of that. And if the leak extends into the genitalia, then edema of the scrotum, or less commonly, the labia in women. Sometimes there may be diminished effluent return because some of the dialysis fluid is lost into the soft tissues. And if there's a leak through the insertion of the catheter itself, dialysis fluid can leak along the outside of the catheter, along the tunnel, and come out at the exit site, where there may be wetness or swelling around the exit site due to this kind of pericatheter leak. It's important to examine the patient and have the patient stand in front of you. It is hard to look for asymmetry and changes if the patient is sitting down. So have the patient stand in front of you. If the complaint is one of diminished effluent return, you may want to do a peritoneal equilibration test, or PET, and the results should be unchanged. But as I said before, a CT scan or radionuclide scanning may be very helpful in this kind of situation to try to better image where the leak is occurring. This is an example of what's called peau d'orange, or orange skin, which is diffuse subcutaneous edema due to leak of dialysis fluid into the subcutaneous tissues. What you can also see here is where the catheter was resting across the abdominal wall. We pulled the catheter away just to take this picture, and you can see the indentation that the catheter has made in the abdominal wall as a result of this subcutaneous edema. Here's another example of a patient who was at risk for leak because of large polycystic kidneys. The dialysis fluid leaked into the abdominal wall, and again, you can see this puffiness or bogginess of the abdominal wall, and where the catheter was sitting, you can see the indentation. This is another CT scan with installation of dialysis fluid and intraperitoneal radiocontrast, which shows white within the peritoneal cavity, but you can see that there is a leak or an exit of the fluid into the soft tissues of the abdominal wall, and that is this white color in the soft tissues. And here's another example where the leak occurred through an umbilical hernia. The dialysis fluid went into the soft tissues, and again, the arrow is pointing to the imprint that the dialysis catheter makes in the edematous soft tissues. So to do these kinds of scanning, you can add radiocontrast, HiPAque or Omnipaque, to a full dialysis bag. Mix it up and infuse the dialysis fluid with the radiocontrast into the patient. Then it's important to have the patient do something to raise the intra-abdominal pressure. Perhaps lie on their stomach, sit down, get up, walk around, things like that, so as to force the fluid to leak where it's leaking. Then you send the patient for the CT scan. If you're practicing in a center that doesn't deal with a lot of peritoneal dialysis patients, it may be wisest to discuss this with the radiologist ahead of time, explaining what you're looking for. So here's another example of a patient who presented with abdominal protuberance and edema, and you can see in this CT scan the white of the peritoneal fluid within the peritoneal cavity, but you can see it is leaving the peritoneal cavity here. This is a lower cut in the abdomen, and you can see the movement of the leaking fluid into the subcutaneous tissues. Even lower still, it's not white because the dye hasn't reached this area yet, but from leak from plain peritoneal dialysis fluid, you can see the heterogeneity of the signal here because of dialysis fluid that is caught in the abdominal pannus.